So this was a really tricky one with really big wax plugs in both ears. So my name's Taylor Green. I'm one of the audiologists here at Audiology Associates.
My name is Rhys Barber. I'm another audiologist here at Audiology Associates. If this is the first time you're watching the video, we're going to talk you through this earwax removal, explain exactly what we're going to be doing on the way, what tools and why we use them as well. So yeah, I'll let you take off. You got to do the last one as well, didn't you? Sorry, Taylor.
No, that's all right. So we've gone straight in with the standard size Zollner tube here. Again, if this is your first time watching, there's only two sizes we use in clinic.
Yeah.
This is the larger of the two. You can see I've already gone in with a small amount of oil here. Kind of similar to the last video we posted, actually. Yeah. The reason I've popped some of this oil in is just to help to work this plug away from the ear canals. Because you can kind of see at the moment it's so full that it's kind of welded itself to the ear canal, and they always take a little bit of work in these ones, especially when they're a bit more on the dry side. It
just reduces that stickiness to the outer side of the plug, doesn't it? Where it wants to hang on to the canal wall, and sometimes they all will go in and just form a bit of a barrier in there, stop it re-sticking when you do get it moving then as well. But I find these ones they're always a little bit of a tougher one to do because they're not quite hard, they're not quite soft, they're kind of this sort of chewing gummy consistency in the middle, aren't they? And that's always a difficult one to move.
You can. I'm not sure if you can see it here, but I'm actually struggling to get a suction grip. That's why I'm trying to just reposition it to get a good grip.
There you go.
There we are, starting to pop out now. But they, like you said, they're a bit of a weird consistency because it's almost too dry for suction. But then when you use a manual tool, it'll just break straight through the centre of it, like fudge, you know, you just kind of...
That's a good explanation, because it's tacky like fudge as well, isn't it? It's that real kind of sticky consistency. That's a lot...
Still looking squeaky there, though.
That's a lot squeakier clean than I thought it was going to look. So the little white patch you can see on the eardrum there, that's actually something called a light reflex, and that's really important. We look out for those every time we're looking in to check eardrum health. If you haven't got a light reflex, it's a good indication that the eardrum maybe isn't sitting in its normal position. So if there's too little air behind the eardrum, it'll pull the eardrum in. Too much air, it'll push the eardrum out, and that will then sort of spread the light reflex out a little bit depending on where it's sitting. So that was a lovely, shiny, healthy looking eardrum.
It's like a textbook eardrum.
It was a textbook.
Pretty textbook.
That's one you want to see. So yeah, standard size back in here to get that grip again, isn't it?
There's a little tiny bump just to the right here, which is kind of going to stop us from getting this out. Now, this patient is a regular patient of ours. Now, she did come in to see me. I think this was around about 15 months ago, roughly, about a year and a half. Now, I did actually refer the patient to get these little bumps sort of checked out. Patient attended ENT and was told there was nothing in there. So
oh, okay, fair enough.
There we are. Okay. So I've done my job.
Okay.
But, oh gosh,
they're usually little cysts, aren't they? And they're not really. You know, there's nothing to worry about. They wouldn't really do a lot about it a lot of the time, just until they get really big.
Yeah, I think it's only normally when they're sort of new as well. Like if it's a really old one that the patient's already had checked out years ago and has been given the all clear, then it's not something we would obviously normally worry about, because you can just see at the top as I roll this forward, there's a little one at the top as well. So there's like tiny little bumps, and that's the only reason why I referred, because I just wanted to get those checked out just to make sure it wasn't like little bony growths or But patient doesn't get any discomfort with them at all, so they don't cause any problem.
So you're using now two different manual tools. So the first one was so why are you opting to use a manual tool now over the suction at this point?
I think this was just a bit trapped, to be honest. I've really struggled to get a grip, similar to the other side where I couldn't quite get that suction grip. I've been just struggling here, getting that grip to pull it forward. So that's where the manual tools come in really handy.
And why the two different ones?
So this one is pretty good for getting into those little tiny gaps. Got to try and avoid that little bump as well.
Yeah, we can see that.
Just really good for getting into those little tiny gaps to start getting this to roll forwards. But the hook is also really good. What we tend to do with the hook is we turn it to the side, we pop it in over the wax, and then we just turn it back down so that it kind of is like a handle, and it kind of pulls that wax forward. It's really good. at rolling these harder, drier ones forwards.
So this is the right curette. This is the kind of the loop one you can see there. You can see the loop side of it there, and that's really good for scooping. So that's why I want you to think of this one is you're getting behind the plug and you're scooping it forwards. Now, if you've got a great bit of room, a gap between the top of the wax and the canal wall, and you can get really far behind it, you'll get that angle to scoop. If you can't, though, that's where the hook is really effective, isn't it? Because the hook just pulls straight. So you kind of imagine this is the hook on the end. You go flat past the wax, turn and hook forwards, and that's really helpful if you haven't got a huge gap at the top, isn't it? And luckily, this tool has one on each end.
Yes, yeah. So it's like it's got the curette, the round one on the one side, and the hook on the other. So it kind of saves you having to use two separate pieces. The only thing you've got to be super careful of with a manual tool, as Taylor explained, if you haven't watched the last video on Friday, go back and watch that one as well, because Taylor explained that the canal walls are really, really sensitive. So you're always really conscious about where the end of that tool's gone. Do you know what I mean? How close to the canal wall are we putting pressure on the canal wall, which can feel a little bit uncomfortable, because the patients aren't anaesthetized, they're not numbed for this procedure, they're just literally sitting in a chair with us, and we're doing this live. So what you're actually seeing here is what's actually going on inside the patient's ears at the time. Very different consistency now, though. You could see I had the hook into the wax there, and you could see me just kind of like shimmying a little bit like this. I was trying to loosen the back end of this plug up, so I was hoping the whole thing was going to pop out.
Oh, that's a good pull. Look at that. That was a beast. That was a huge plug.
We've got a little, you could see those two little bits there. Again, if you want to pause the video, it's a bit quick there, so you need to hold it a bit longer.
So that last plug you took out then, that's what, 1.5 centimetres. So what's that? 3/4 of an inch. Wow, that's a good one.
Another 5.5 centimetres.
Well, guys, we've popped another video. If you're watching this on YouTube, we're going to pop videos that we suggest up in the top corner. So I think what I put down for this one, polyps and plugs.
Oh,
there you go. That's a good one to move on to from this one, actually. So go and check that one out as well. But we've got what, 5 centimetres to, or just did you send me just 2 inches? Sorry,
I did already.
Oh, did you?
Yeah.
Oh, so I missed that bit. But guys, I hope you enjoyed the video as much as we did voicing over. If you did, don't forget you can always like, heart, share, follow, and subscribe for us. There's another 1,238 videos. You could go and have a look back through the back catalogue if you're interested. But as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another. And myself and lovely Mr. Taylor Green will talk to you in the next video on Wednesday. And members, we shall see you tomorrow. Bye, everybody.
Bye-bye.